During my 5 short years of working in an emergency department, I've seen many people's lives have been forever changed due to a stroke. According to the American Stroke Association, someone in the United States has a stroke once every 40 seconds. A stroke can lead to long-term disability or even death, and treatment must begin within the first few hours that the symptoms start. For this reason, I will be instructing you today on what a stroke is, including risk factors, signs and symptoms of a stroke, and why the minutes matter, in hopes that you will be able to easily recognize a stroke. First, I will be discussing what is a stroke and what are the risk factors. According to strokecenter.org, a definition of a stroke is a blockage or abnormality in an artery causing a lack of blood flow to the brain. The 2 main types of strokes I will be discussing today are the ischemic and the hemorrhagic stroke. An ischemic stroke is caused by an artery in the brain being obstructed and preventing blood to be delivered to the brain cells. According to the American Stroke Association, 80% of all strokes are ischemic strokes. The obstruction can be caused by cholesterol buildup in the artery or a blood clot. A hemorrhagic stroke is when a blood vessel in the brain leaks blood into or around the brain tissue. Here I have an example of the 2 types of strokes. Here is where the clot blocks the blood flow to the brain, and this dark area is where the brain cells have died. And then this is a hemorrhagic stroke. You can see the bleeding from the vessel into and around the brain tissue here. So what are the risk factors for a stroke? The most common are high blood pressure, high cholesterol, diabetes, heart arrhythmias such as AFib, which causes blood clots, smoking, age, and a previous history of a stroke or a TIA. According to the Internet Stroke Center, the most important risk factor is high blood pressure, and it contributes to more than 12.7 million strokes worldwide. The most important thing I will be discussing with you today is signs and symptoms of a stroke. Depending on where the blockage or bleeding is in the brain depends on what symptoms the person will present with. If the blockage or bleeding is on the right side of the brain, you will see normally left-sided weakness, as well as vision problems and inability to recognize objects. If the bleeding or blockage is on the left side of the brain, you will see that weakness in the right side of the body and also see speech and language problems. Signs and symptoms of a stroke include numbness or weakness to the face, arms, and legs of one side of the body, confusion, trouble speaking or understanding speech, vision loss or blurriness in one or both eyes, loss of balance, and a severe headache. A great mnemonic that we use at my work and we teach the public to remember signs and symptoms of a stroke is called B FAST. B is for balance. Does the person have a sudden loss of balance? Eyes, has the person lost vision in one or both eyes? Face, does the person's face look uneven? Arms, is one arm numb or weak? Speech, is the person's speech slurred? Do they seem confused? And T is for time. Call 911 or seek medical attention immediately. So why is time so important? Why do the minutes matter? A saying that I learned in nursing school was time is brain. According to Novant Health, for every minute a stroke is left untreated, approximately 2 million brain cells can die. The national standard treatment for an ischemic stroke is a medication given intravenously called TPA. This medication is also known as a clot-busting medication that can potentially reverse the symptoms of a stroke. The only problem with this medication is that it can only be given within 4.5 hours that the symptoms started. If you are past that 4.5 hour time frame, some hospitals have the ability to take a catheter and remove the clot from your brain, or actually inject the TPA into that blockage to help restore the blood flow. I actually have an example of someone that had a blocked artery in their brain. This was before the TPA. You can see there's no blood flow or perfusion here. And this picture is after the TPA, and you can see the return of blood flow to that artery, which is great. treatment for a hemorrhagic stroke is normally just with surgery to stop the bleeding. Outcome for these stroke patients, it can be different for each person, but a greater recovery is more likely with prompt treatment. A stroke can happen to anyone at any time. Thanks to many medical advances, stroke treatments and survival rates have continued to grow throughout the years, but strokes continue to be the leading cause of long-term disability in the United States. My goal in sharing this information with you today is that you will be able to recognize the symptoms of a stroke and to remember how important it is to seek medical attention for you or your loved ones. Always remember that time is brain and be fast. Thank you.